Meow. Huples cat. Just want to talk about the politics of COVID a little bit. There is no politics of COVID. Covid-19 disease from SARS-CoV-2 does not care if you're a Liberal or a Democrat or a Republican or a Nazi. It doesn't care if you're black, white or brown or green or yellow or white or pink or orange. It doesn't care. What it cares to do is it cares to transmit from one person to the other. So one of the fascinating things about this pandemic is that we know all of the stuff that we're doing now works. We know all of the things that we're doing that don't work, that was tried in 1918 and 1919 and in previous pandemics. And yet, just being fully open won't work. Enough people will get sick and die that the economy will tank. There's enough people around who are smart enough and look at statistics and see personal death as something to be avoided at all costs that won't actually resume normal economic activity in a pandemic. So what do you do? Well, what we're doing in the West is partial lockdowns. So some regions are locked down or some industries are locked down, and that will partially decrease transmission, but it won't stop the underlying increase of transmission in the population, and it will cause specific economic hardships to target groups. That's not a great idea. The other thing you can do is you can do a full lockdown where you shut everything down, and this is easily done. You can deliver food to people, you can have them go to grocery stores on a rotational basis once a week. There's a lot of things you can do. The reason we're not doing it is political, and this is where the politics comes in. It would cost initially a large quantity of cash to enforce a proper national, with borders sealed, lockdown. And for some reason the politicians, who are mostly extremely wealthy people with large houses and gardens and well protected from the human transmission, don't want to do that for their population. They are targeting their population in odd ways. So, yes, you can't lock down if you're going to lose your house and become homeless, because then actually locking down is going to be difficult for you. But there's no reason at all why welfare and government subsidies could not be regular, weekly, and consistent during a prolonged pandemic like this. No reason at all. The reason the governments are not giving stimulus checks, which is a ludicrous thing to do, because you can't stimulate an economy in the middle of a pandemic. But what you can do is you can give increased amounts of welfare to the newly unemployed, the partially employed, and the unemployed to start with, to make sure that they're not suffering economically whilst they're being locked down. You can also distribute decent masks. You could, after 7 months of a pandemic, you could easily have N95s available for school teachers.
A much shorter line for testing today. Across Ontario, COVID tests are now by appointment only.
This is so much better. Amazing, so much better, yeah. And it was so nice to be able to book a spot, and especially when you have a little one.
But there's confusion. The province just announced the change on Friday afternoon, and today some testing centres are closed. This couple didn't have an appointment and gets turned away. The province wants to end the hours of waiting at testing centres and cut the backlog at labs. That's now at almost 79,000.
Julie speaking.
Toronto Public Health is now putting contact tracing on hold, except for congregate settings like schools, hospitals and nursing homes. Even with 1,000 staff, they can't keep up.
The system is overwhelmed right now. The number of cases and outbreaks expanding throughout our city requires more immediate interventions, and if not, we're headed towards more severe lockdowns.
The longer delays in testing means tracing starts later and becomes less effective.
There's a lot of things we could be doing. In Canada, N95s are not easily available for nurses in teaching hospitals. They are if you are looking after a COVID positive patient or a person that's probably COVID. But if you're in the emerge and you're just dealing with patients, or if you're in the ICU dealing with other patients, no, you're not wearing an N95, you're wearing a half-assed surgical mask.
Ontario is doing a lot of testing, but the province is struggling to process them. Right now, there's a backlog of more than 26,000 tests. Global News has learned the province is launching a rapid training program which could put up to 600 workers into medical labs. That should help ease some of the strain. But as our chief investigative correspondent Carolyn Jarvis reports in this Global News exclusive, Ontario and the federal government have known about the labour shortage for years.
Which doesn't prevent you getting the infection particularly unless everybody's wearing them, and then it reduces it. So the N95 is the way we should be all wearing now. Work in hospital care and police care and fire services, everybody should be wearing N95s. And we're not, because we still haven't built enough, because the willingness is not there. Now let's get into the cost of all this. It's astronomical. I mean, it really is, but it's an important thing to spend. It's like, if you looked at the economics of COVID and said it's not worth paying the money, we should just let 1 million or 2 million mostly older people die in America because F them, I want to have my life unaffected. You're missing the major point here. It's not just the elderly. It's not just the dying. It's not just the already sick. And we're setting ourselves up for transmission rates that are going to be in the 50 to 60% range. It looks like immunity is at best weeks to months. And for some people, it appears to be around about the 4 to 5 month period. So we would just have a lot of people die. The economy wouldn't really open up because most people like me, I'm not going out. Like, I'll tell you that right now. No chance. There's a pandemic going on. It's airborne. I'm not going to the restaurant. So the economy wouldn't really be helped. You would then be faced with a situation in 5 to 10 months where you've got a massive outbreak of Covid-19 hospitalization again. And that will, again, stop people like me going out. So what's the answer to this? Well, the answer to this is full-on lockdowns, national lockdowns, as tight as you can make them. Try and cut trains of transmission as far as you can. Do it for 2 weeks, do it for 4 weeks, do it for 6 weeks, maybe 8 weeks if you feel the need to do that. During that time, make sure people are homed and fed and get decent cash so they can actually be okay. And for those people out there who are going, money trees, we have given trillions of dollars to very, very wealthy corporations like Exxon and Amazon and Microsoft for years. It's time we stop subsidizing them unless they need it not to go broke. And right now they're making massive amounts of money. It's a massive wealth transfer to the elites. And give it to everybody. Give it to the poor for a few years. We can do it for 2 years or 3 years without any problem. We did it in World War II, we did it in World War I. This is as bad, this is killing as many people as war. It isn't influenza, and it's not something to be trivialized. Now, on which topic? The opposite is also true. There is a large amount of nonsense out there in the press trying to make people terrified to leave their homes. For example, I'll give you a specific. The flu vaccine. If you can get it, good luck. But this year's flu season will be very serious and will cause massive problems. Well, if you look at normal flu seasons, we got COVID with flu on top of it. Not good for the hospital. But why is nobody talking about winter in the southern hemisphere? They've already had 6 months of COVID-19 and they're moving into their winter. And yet their flu influenza rates are historically low because everybody's washing hands, keeping distance and wearing masks, which blocks transmission of airborne viruses and bacteria. So influenza, which is a virus, is not transmitting very much in the southern hemisphere. And unless we fully open up here and people continue not to wear masks up here, we won't have a bad influenza season. Now, I'm tempting fate because it could mutate into something deadly. It did in 1918, but it would be unusual and it would be kind of stunning if it did. So I'm expecting a mild flu season. So if you want to get your flu shot, get your flu shot. I don't for various reasons, but it's up to you. Look at the risks for you and all the rest of it. But if you want to get the flu shot, get it as soon as you know it's available because it's just not going to be there. If you wait too long and we do have a viable vaccine or a non-viable, unsafe vaccine that they decide to give anyway, which is likely, there won't be any syringes. We don't have enough. We don't manufacture enough syringes. We haven't really increased syringe manufacturing capacity any more than we have N95 capacity. Yes, it's gone up a bit, but not a lot. Again, that is political. The free market is unwilling to spend a pile of money tooling up for something that in 3 months or 6 months would have no market, and rightly so. That is the role of government, and government is to instruct and support the free market, when faced with a national or global calamity. If they don't do that, if they leave it up to the free market fails. This is well known, it's well documented in history. So the people out there that want everything open, no government subsidies, go back to how it was in February, you're delusional. It ain't going back to how it was in February until transmission is effectively zero in our communities, at which point there will be a slow recovery, and a fast recovery in areas that actually kept transmission rates down low by lockdowns. Hard, severe lockdowns work both for preventing death and for preventing transmission and for helping the economy survive. But you have to have government. There's no doubt in my mind, nor in most of the right-wing people in the world, that you have to actually go lefty on welfare during a national emergency like this. No other real choice. Well, there is. You can just let people die. But the problem is that it tanks the economy, and it tanks the economy for longer. And I've been saying this for months, but people still clinging to their wishful thinking that if we just stop these silly mask policies and distancing policies and stop with the fear, because it's nothing much, that a 3% infected death rate is fine. I do suspect that those people out there, as soon as their loved ones catch Covid-19 and die from it, will have an entirely different perspective. But by then it will be too late. If you agree or disagree with me, I don't really mind. I'm putting this stuff out there for people to try and see where my thought process is. It's October 20th, 2020, is it? It's October 2020. Anyway, that's it. Toodles. This was a Sleeping Cat production 2020.